Welcome, everyone, to the Deep Dive.
Great to be here.
Today, we're taking a close look at a condition that, well, maybe doesn't grab headlines all the time, but it's really important if you're caring for horses, especially mares. We're talking about equine mastitis. We've gathered some excellent sources to guide us through this. We'll cover everything from the underlying causes right through to the treatments.
Yep.
Our mission really is just to make this complex topic clear, actionable, and, well, informative for you.
That's right. And, you might not hear about it as much as maybe other mare health issues.
Sure.
But the fact that equine mastitis is relatively rare in mares compared to, say, dairy cows, that actually tells us something about their natural defenses, which are pretty incredible.
Ah, okay.
But when it does strike, it's serious. It's painful for the mare, particularly during lactation or that drying off period.
Right.
It's almost always caused by a bacterial infection. And acting fast is crucial, really crucial for the mare's reproductive health and her overall well-being.
So this discussion should give you a good shortcut to getting really well informed on this specific challenge.
Exactly. Solid overview.
Okay, let's unpack this then. At its most basic level, what is equine mastitis and why should we understand it, even if, like you said, it's relatively low incidence?
Okay, so at its core, mastitis just means inflammation of the mammary gland, the udder, basically.
Simple enough.
And most commonly, this inflammation is triggered by bacteria. They've somehow found their way inside the gland.
Okay.
Less often, it could be something else, maybe a tumor, or even though rarely a fungal infection. What's interesting, though, is that even though it can be serious, it's actually not that common in mares.
Right, you mentioned the defenses.
Yeah, exactly. It's partly thanks to things like the foal nursing frequently, the mare's lactation period being relatively short, and their teats being smaller and kind of more concealed. Natural protection.
So how does the infection actually start? You said bacteria get in.
Right. The usual way is what we call ascending infection. Basically, bacteria travel up through the teat canal.
Ah, like a little pathway.
Exactly. Think of it as a tiny entry point. Less often, bacteria might spread through the bloodstream, maybe from an infection elsewhere in the body, or sometimes from severe skin inflammation right next to the udder.
Okay.
Now, just having bacteria present doesn't automatically mean mastitis happens.
Oh, interesting.
Yeah, this tells us the mare's own immune system, both, locally in the udder and systemically, plays a really big role in fighting things off.
Right.
But if an infection does take hold, you get inflammatory cells and cellular debris clogging up that teat canal.
Okay, like a blockage.
Pretty much.
Yeah.
And that leads to increased pressure, poor drainage, and then the infection can spread more easily, mostly affecting the reproductive system and, of course, making the mare uncomfortable.
So we understand the what. Let's move to the why. What actually leads to this? What are the common culprits, the bacteria, and what situations make a mare more vulnerable?
Okay, the why. Well, the primary culprits are almost always bacteria.
Right.
And the most frequent ones we find are pretty common bacteria, things you'd find in the horse's environment, especially a group called Streptococcus species.
Like strep zoo? I think I've heard of that one.
Exactly. Streptococcus zooepidemicus is a big one. But other environmental bacteria like E. coli, Klebsiella, Staphylococcus species, they can all cause trouble too. Think manure, bedding, soil, they're often hanging out there.
So environment is key. What else puts a mare at risk?
Well, beyond the bacteria just being there, several things can kind of pave the way for infection. First up is trauma.
Makes sense.
Any injury to the udder or teats, a kick from another horse, a bite, even just a scrape from something in the pasture that creates an open door for bacteria.
Right.
Then poor hygiene. This is a big one. Dirty stalls, muddy pastures. It just ups the exposure to all those environmental pathogens.
Stands to reason.
Changes in lactation are also really important. That drying off period when milk production is supposed to be decreasing, milk can kind of pool or stagnate milk stasis, making the gland more susceptible.
Ah, okay.
And similarly, if a mare tragically loses her foal, her udder can become engorged with milk, and that increases the risk too.
What about other things? Insects?
Yep, insect bites, fly bites especially. They cause irritation, little wounds, and can potentially introduce bacteria.
Ugh, fleas.
Tell me about it. Also, mares with a compromised immune system, for whatever reason, they're naturally going to be more susceptible. And while a mare's udder is smaller and more tucked away than, say, a cow's, anatomical factors still mean they're vulnerable, Then there's systemic disease, any illness the mare has that could potentially spread to the mammary gland, or local skin issues right around the udder, cellulitis, wounds, even allergic reactions like coulicoids, hypersensitivity. A recent surgical incision nearby could also be a risk factor. And finally, if you have situations like compromised foals or mares needing hand milking, that extra manipulation can sometimes increase the risk.
Oh, okay, that's quite a list of potential triggers. And, this brings up a really important point for owners, because sometimes you might see signs that look just like mastitis, but it's actually something completely different.
Yeah.
What are some of those lookalikes that vets need to consider?
Exactly. It's not always a bacterial infection, and figuring that out is critical. So, less common causes that might present similarly.
I'm sure.
Well, first there's neoplasia. That just means tumors.
Tumors in the udder.
Yeah, mammary tumors like adenocarcinoma. They are rare in horses, but they can happen.
Okay.
You might also find abscesses, which are basically pockets of pus developing within the udder tissue itself.
Yeah.
While very uncommon, fungal infections could potentially cause similar signs, things like aspergillus. And then you get into some really unusual territory, like aberrant parasitic infections where parasites end up where they shouldn't be, or even, uniquely in some species, avocado toxicity has been linked to mammary gland issues.
Avocado. Seriously.
Seriously. Though perhaps less documented in horses specifically, it's on the list of possibilities in general toxicology. So yeah, a vet's thorough investigation is absolutely key to avoid misdiagnosis.
Absolutely. So if a mare is showing those worrying signs, the swelling, the pain, how do veterinarians actually nail down the diagnosis?
Sure.
What are they looking for clinically? And what tests really pinpoint mastitis?
Right, getting that definitive diagnosis involves putting together a few key pieces. First is observation and physical exam, then the lab tests confirm it.
Okay.
So clinically, what you or the vet would typically see is mammary gland swelling, heat, and pain. The mare might be obviously uncomfortable.
How so?
Well, she might be reluctant to move, maybe walks stiffly or stands with her hind legs spread apart a bit, trying to ease the pressure and pain. A really key indicator is abnormal milk. It might look watery or cloudy, maybe discolored yellowish, even reddish if there's blood. Or it might contain flakes, clots, or even obvious pus.
But you said sometimes it looks normal initially.
Yes, that's the tricky part sometimes. The milk can look normal at first glance, especially early on. Also, mares might flat out refuse to let the foal nurse because it hurts too much.
Poor thing.
Or the foal just can't get milk out effectively. And beyond the udder itself, you might see systemic signs, especially in acute sudden cases. Things like fever, lethargy, acting depressed, loss of appetite.
Okay.
And sometimes even a subtle lameness in the hind leg on the same side as the affected gland.
Really? Lameness.
Yeah, likely due to pain and inflammation radiating or just the discomfort of moving that leg near the sore udder. And you might also see swelling and fluid buildup under the belly. Near the udder, we call that ventral edema.
Okay, so lots to look for. What does the vet do during the physical exam part?
During the physical exam, the vet will carefully look for any asymmetry between the two halves of the udder, check for swelling, redness, any skin lesions or wounds. Then they'll gently palpate, feel the udder. They're assessing for heat, checking the degree of pain on palpation, feeling for firmness, and trying to detect any distinct masses or potential abscesses.
Right.
And of course, they'll carefully examine the milk itself, stripping a small amount to check its consistency, color, and look for any of those abnormalities we mentioned.
Okay, that makes sense. So once you've got those initial findings, what are the lab tests, the ones that really give you the definitive answer and guide what to do next?
Right, the diagnostics that really clinch it. The first big one is a cytological examination of mammary secretions.
Okay, cytology. What does that involve?
Basically, a milk sample is collected very carefully, aseptically, to avoid contamination, and then it's examined under a microscope.
And what are you looking for?
You're looking for evidence of inflammation at a cellular level, specifically a big increase in inflammatory cells, particularly neutrophils.
Neutrophils, those are the immune cells, right?
Exactly. They're like the first responders of the immune system. In normal milk from a lactating mare, you might see very few. But in a mastitis sample, you'll see loads of them, both intact and degenerated ones, plus cellular debris, and often you can even see the bacteria themselves or fungal elements if it's a fungal case.
Wow, so you can literally see the fight happening in the milk.
You absolutely can. It's a direct window into what's going on inside the gland.
Incredible. Okay, what's next after cytology?
The second, and arguably the most crucial test, is bacterial culture and sensitivity.
Ah, culture, to find the specific bug.
Precisely. You identify the exact bacterial culprit or culprits, sometimes there's more than one, and just as importantly, the sensitivity part tells you which antibiotics will actually be effective against those specific bacteria.
So you're not just guessing with treatment.
Exactly, it guides the therapy. A gram stain might give some initial clues while waiting for the full culture, but the culture and sensitivity is key. Anaerobic bacteria, by the way, aren't usually significant players here.
Good to know. Any other tests commonly run?
Yeah, often a complete blood count, CBC, is done on the mare's blood. This looks for signs of systemic inflammation.
What might that show?
It might show leukocytosis and increased white blood cell count, specifically neutrophilia, more neutrophils. Also, maybe hyperfibrinogenemia, increased fibrinogen, which is an inflammatory protein, or increased SAA, serum amyloid A, another inflammation marker, sometimes even anemia if it's been going on a while.
Right.
While it's used more in dairy cattle, sometimes a somatic cell count, SCC, is done on the milk. An elevated count, say above 50,000 cells per ml in mare's milk, points towards inflammation.
Right. And imaging.
Yes, ultrasonography, US of the udder, is really useful.
How does that help?
It helps the vet see the extent of the inflammation within the gland tissue, helps identify any abscesses that might need draining, or rule out other causes of swelling, like tumors or hematomas, which are blood clots.
Very helpful.
And finally, in some tricky cases, maybe if the mare isn't responding to treatment as expected, or if the cytology wasn't clearly bacterial, a mammary gland biopsy might be considered.
Okay, a biopsy is a last resort kind of thing.
Sort of, yeah. Or if neoplasia is strongly suspected. And throughout this whole process, the vet is also thinking about those differential diagnoses we talked about, ruling out simple udder engorgement, or an abscess versus diffuse mastitis, or issues related to pregnancy like placentitis or impending birth.
Got it. So a thorough process. Once you have that clear diagnosis of mastitis, what does the treatment plan usually look like? What are the main goals?
Okay, treatment. It's really a multi-pronged approach. The main goals are eliminate the infection, reduce the inflammation and pain, and manage the milk situation carefully.
Right, makes sense. Where do you start?
First up is usually antimicrobial therapy. Systemic antibiotics given by injection or orally are often started right away.
Even before the culture results?
Often, yes. You'd typically start with a broad-spectrum antibiotic that covers the likely suspects, like trimethoprim sulfa, or maybe penicillin, or a combination like penicillin and gentamicin.
Okay.
Then, once those culture and sensitivity results come back in a day or two, the antibiotic choice can be adjusted to be more targeted and effective, if needed.
And what about putting antibiotics directly in the udder, like they do with cows?
That's intramammary antibiotic therapy. It can be considered in mares, but it's actually less common than in cows.
Why is that?
Mainly because the mare's teat canal is smaller and shorter, making the infusion process itself a bit more delicate and potentially irritating. If it is done, it has to be done very carefully and aseptically. Treatment duration overall depends on how the mare responds and the culture results, but often it's around 5 to 10 days, sometimes longer for stubborn cases.
Okay, antibiotics are key. What else? You mentioned inflammation and pain.
Absolutely essential. Anti-inflammatory and pain management is crucial. We use non-steroidal anti-inflammatory drugs, NSAIDs.
Like Banamine or Bute.
Exactly. Flunixin miglumin, which is Banamine or phenylbutazone Bute. These are vital. They reduce the pain, the swelling, the fever, which makes a huge difference to the mare's comfort.
And probably her willingness to cooperate with everything else.
Precisely. If she's feeling better, she's more likely to allow nursing or milking, which is also important.
Okay, so what about those local therapies? Things you can do directly to the udder?
Yes. Local therapy plays a big role. If the mare is lactating, then frequent milking or stripping of the affected side is really important.
Why is that?
It helps remove the accumulated milk, but also the bacteria and the inflammatory gunk, basically.
Wow.
It reduces pressure inside the gland and promotes drainage.
Okay. But you mentioned a caveat for drying off mares.
Yes, crucial point. If the mare is supposed to be drying off, you want to avoid excessive milking. Milking stimulates more milk production, which is the opposite of what you want then. So maybe just enough to relieve excessive pressure, but not full stripping multiple times a day.
Got it. What else locally?
Hydrotherapy can be fantastic. Coal hosing the affected udder gently for maybe 15-20 minutes, several times a day. That's great for reducing swelling and pain, especially in those really acute hot stages.
Like icing an injury.
Kind of, yeah. Then, once that initial acute inflammation starts to settle, switching to warm compresses or hot packing can help promote blood flow and drainage.
Okay.
Topical poultices can also be helpful. Things like an Epsom salts paste, or there are commercial preparations available. They can help draw out inflammation and reduce swelling.
Mm-hmm.
Gentle massage around the area, not directly on acutely painful spots perhaps, but around the edema, can help mobilize that fluid and improve circulation. And even encouraging light exercise, like hand walking, if the mare is comfortable enough, can help decrease that ventral edema.
Right. Get things moving. What about the foal, if there is one?
Ah, yes, foal management is critical. If the mare is in severe pain or if the milk looks really abnormal, pus-filled, for example, you might need to temporarily separate the foal.
And feed it how?
You'd need to hand feed the foal with a good quality milk replacer. This ensures the foal gets enough nutrition and, importantly, prevents it from drinking contaminated milk, which could make the foal sick. You have to monitor the foal's health very closely in these situations.
Makes sense. Anything else in terms of general care?
Definitely supportive care. Keeping the mare in a clean, dry stall is crucial. Minimize that environmental contamination to prevent reinfection.
Good hygiene again.
Always. And implement good fly control measures to reduce those irritating bites. Finally, in specific situations, surgical intervention might be necessary.
Like what?
Well, if a distinct abscess has formed and isn't draining, surgery might be needed to open it up and establish drainage. Very rarely, if neoplasia, a tumor, is confirmed or strongly suspected, a mammectomy, which is surgical removal of the mammary gland, might be considered, but that's uncommon.
Okay, that covers a lot of ground on treatment. So looking at the bigger picture, what's the usual outcome? What's the prognosis for a mare with mastitis? And maybe more importantly for owners, what can be done proactively to prevent it?
Generally, the prognosis for acute equine mastitis is actually quite good, provided it's caught reasonably early and treated appropriately.
That's encouraging.
It is. Most cases respond really well, and you often see complete resolution within about 5 to 7 days of starting proper treatment. Long-term complications like significant scarring or permanently reduced milk production and future lactations, those are actually pretty rare in mares compared to, say, dairy cows.
Okay, good news mostly, but what if it's not treated promptly?
Well, that's where problems can arise. Without prompt or adequate treatment, complications like abscessation, that pocket of pus forming, or induration, which is a hardening or thickening of the gland tissue due to chronic inflammation and scarring, those can occur. And those can lead to more chronic, persistent issues.
And you mentioned potential systemic problems earlier, too.
Yes, if it's left untreated or becomes very severe, the infection can potentially spread systemically. You could see serious conditions like sepsis, which is a dangerous body-wide inflammation, or bacteremia, bacteria in the bloodstream.
Scary stuff.
It can be. Also, endotoxemia, where toxins from the bacteria get into the blood, which can trigger things like laminitis, that awful hoof condition, or colitis, inflammation of the colon. You might also see signs of infection spreading locally, like swollen lymph nodes, lymphadenopathy, or inflamed lymphatic vessels, lymphangitis. And as we touched on, there's the risk of fibrosis or scarring within the gland, which could potentially decrease milk production later on.
Okay, so prompt treatment is definitely the key takeaway there. What about prevention? How can owners minimize the risk?
Prevention really boils down to good management practices. Top of the list is maintaining excellent hygiene in the mare's environment.
Especially at certain times.
Exactly. Especially crucial during lactation and that tricky weaning or drying off period. Clean, dry bedding, clean pastures as much as possible.
Makes sense.
Also, promptly treating any teat or udder injuries, no matter how small they seem. Clean them well, apply appropriate antiseptic, and keep an eye on them. Don't let a small scratch become an open door.
Good advice.
Owners should also monitor mares closely during the drying off period. Watch for any signs of excessive udder engorgement or inflammation, heat, pain, swelling. Catching issues early is key. And one management practice that can help during weaning is to gradually reduce the mare's feed intake, particularly concentrates. This can help signal her body to dry up milk production a bit more rapidly, reducing that period of engorgement and potential stasis.
Ah. Okay, a practical tip there.
Yeah, it can make a difference. So good hygiene, injury care, careful monitoring during lactation changes, those are the main pillars of prevention.
Well, we have certainly taken a deep dive into equine mastitis today.
Right.
We've explored the causes, the sometimes tricky diagnostic process, and the really comprehensive treatment approaches. It's clear it's a condition that needs prompt attention, but it sounds like with the right knowledge and swift action, it's often very manageable. Hopefully everyone listening feels much more informed now about this really important aspect of equine health.
Absolutely. And, you know, if we sort of connect this back to the bigger picture, It really highlights how things that seem small, maybe minor environmental factors, a bit of poor hygiene, a small injury, how they can actually cascade into significant health challenges if they aren't recognized and managed properly.
That's a great point.
And it kind of raises a broader question, doesn't it? Beyond just dealing with physical ailments, how does understanding the detailed process of a disease like mastitis, the causes, the body's response, the treatment interactions, how does that deeper understanding actually contribute to a more holistic approach? Not just reacting to problems, but proactively managing animal welfare and health overall.
That's definitely something to think about, how understanding the why and how of one specific issue helps us become better, more proactive caregivers in general.
Exactly. Something to consider as you continue your journey of learning about horse health.